In order to help determining the prevalence of COVID-19 infection in the community as part of the national strategy for the next period of response to COVID-19 pandemic, the National Serological Survey of COVID-19 was launched on 12th of July 2020, with the survey being conducted in stages consisting of 4 cycles. Each lasts for 5 days, where the time between each cycle and other is 2 weeks over 10 weeks.
We have started the second cycle of the Sero survey to determine the prevalence of COVID-19 in the community. It is worth mentioning that the previous round has received positive community interaction and excellent participation from both Omanis and non-Omanis. Therefore, I'm really encourage people, those who are going to be called to participate and help us to reach the target number. Again, it's a blood test, not a nasal swab. It is free of charge, and the participant will receive the result electronically.
The challenges that faced by the teams at the field level were realized and effective solutions were found to ensure that the survey process continues smoothly in the way it was planned. The collection of samples has been completed as per the numbers required for the first cycle, and the necessary diagnostic tests are carried out, and the work is underway to finalize the analysis of the results. The Directorate General of Disease Surveillance and Control will prepare a detailed report on the results of the first phase during the coming period, and the next phases of the serological survey will be completed to assess the trend of the disease spread as planned. The first phase has contributed to clarifying the survey mechanism, during which individuals are selected to participate, whether citizens or residents of different age groups in all governorates of the Sultanate. However, some of the things that raised the questions among individuals in the community should be emphasized, including 1. The selection of people to participate will be randomly based to avoid the selection bias in the collection of samples and therefore increase the possibility of generalizing the results later. 2. The person selected to participate in the survey will receive a text message from Ministry of Health that he or she has been selected. This message will be followed by a phone call to receive the initial verbal approval. That person is then directed to the nearest health institution where written approval will be taken with the completion of the participants' demographic data that will be collected through Tarassud Plus application. 3. That the person will not be subjected to isolation after taking the sample during the waiting period of the result and will not be obliged to wear the electronic tracking bracelet. 4. To emphasize the availability of members of the public health staff and medical staff who are able to communicate in different languages for non-Arabic speakers. It should be emphasized here that there are no legal consequences for not participating in the survey, as the process of participating is completely voluntary. But public awareness should be raised on the importance of this survey in assessing the prevalence of COVID-19 infection according to age group and monitor and diagnose laboratory cases. From the Minister of Health, I'm Abdullah bin Ahmed al-Rubaiey, Sultanate of Oman.